Bismillahirrahmanirrahim. The quote of the day is research is the process of going up alleys to see if they are blind. A quote by the Marston Bates. Today the topic of research is health system. Today the topic of presentation is health system research under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is the definition of health system research, health system objectives and purpose of health system research, specific question for specific levels of service, participant and guidelines of health system research, steps in the development of health system research proposal, and identifying and prioritizing topics for research. By the end of this presentation, participants will be able to describe the definition of health system research, specific questions for specific levels of service, guidelines for health service research, steps in the development of health system research proposal, identifying and prioritizing topics for research, health system research in Pakistan issue and their issues, challenges, and way forward. Know the definition of health system research. Health system research is concerned with the improving of health of people and communities by enhancing the efficiency and effectiveness of health system as an integral part of overall process of socio-economic development with full involvement of all partners. Know what is meant by the health system. Some experts describe it as a narrow definition which involves different levels of public health care services, like from national to the village level. Like in national level, it involves the Ministry of Health, national hospitals, national health training and research institutes, while in zonal or provincial level, it includes zonal, regional or provincial hospitals, health team and training research institutes, while in district level, it includes district hospitals, health teams, health boards and committees, district councils and development committees, and intersectoral and district health training and research institutes. While at division and ward level, it includes the health centers, health center committees, and in village level, it includes the village health workers, traditional birth attendants, village health committees, and village development committees. While in many health system researchers have a wider perception of health system that also includes the NGOs, medical practice by private doctor nurses, the pharmaceutical industries, non-biomedical professionals like professionalized healing systems like Chinese, Unani, and homeopathic medicine, traditional folk medicine with traditional birth attendants, herbalists, and diviners. This is a broadly defined health system that includes the public sector as well as the private sector. It also includes the socio-economic factors, political factor, culture, physical and epidemiological factors. It have the all the health sectors involved that are at the level of national, regional, district, community, or family level. There are also the involvement of agriculture, education, and public work, water supply, and sanitation level. It also involves the NGOs and international organizations, self and community care, like the care provided to the newborn by the mother and grandmothers, folk medicine, and private practice and pharmaceutical industries. The objectives of health system research. The major objective of health system research is to provide health managers at all levels as well as community members with the relevant information they need to make decisions on health related problems that they are facing. The importance of health system research is to it is needed to strengthen the healthcare, work with real field problems, use variety of research disciplines, apply practical scientific knowledge for improving healthcare and health status. The purpose of health system research is to solve the problems, to improve the health of people through improvement of various interrelated components of health system, to enhance the efficacy and efficiency of health system as an integral part of overall socio-economic development, analysis of problem from technical and human angle, and translation of research results into implementable solutions. Now the focus of health system research. Focus is primarily on the primary health care, including integration of treatment and preventive measures for control of diseases, nutrition, family planning, environmental safety, and problems of referral. It involves learning how to work with other sectors in wide range of development activities that may prove important for health. Now, specific questions for specific levels of service. Health system research is not only of use to policymakers. At each level, managers may have questions that require further research. Like at the level of health policymakers, the questions may arise, what would be the acceptable contributions for different income groups? Or the question may arise that what should be the pooling of resources take place on community or national levels? While at the level of managers at district or provincial level, the questions may arise: what is the neonatal mortality in certain districts much higher than in other districts? While at hospital directors, uh, they may try to find why do we have such a high rate of complications during childbirth? Are the first line services available and adequate? Are our own services adequate? Are mothers coming late for delivery, and if so, why? Now, at the level of managers at the village levels, the questions may arise that how can we assist women with little or no education so that they can effectively recognize the symptoms of pneumonia and go in time to the health center with their children. Now, the participants in health system research. Health system research is not the concern of scientists alone. It is a transdisciplinary. It involves participants from the multiple disciplines such as from the agriculture sector, from the water supply and sanitation, from different NGOs and from pharmaceutical industries. It is a teamwork of from different disciplines. In the process, they need to acquire a basic understanding of the concepts and approaches as well as the potential and limitations of research techniques used in the sister disciplines. Who should be involved in health system research? To ensure that the research is relevant and appropriate, everyone directly concerned with the particular health or healthcare problem should be involved in the research project focused on it. They may include policymakers, managers from the health and other public services that are already explained, healthcare providers, and the community itself. Their involvement is crucial if the research activities are to make a difference. Now, the guidelines for health system research. Health system research has to focus on priority problems in the health area, that which health problem is more serious and it has to be addressed earlier. It should be action oriented, i.e. it aimed at developing solutions. It is a multidisciplinary approach. It is participatory in nature. It involves multiple participants. Research must be timely. The outcomes should be timely so that the problems should be earlier addressed. Simple, short term research designs. It should be cost effectiveness and available to all the community members. Results should be presented in formats most helpful for administrators, decision makers, and the community. And at the last is the evaluation of the research. Now this is the flowchart describing the steps in the development of a health system research proposal. The steps and the questions and the important elements involved in the health system research. The first step may arise, that is the selection, analysis, and statement of the research problems. The question may arise that what is the problem and why should it be studied? And the important elements in it is the problem identification, prioritizing of the problems, analysis, and the justification. The next step would be the literature review, in which the question may arise what information is available. For this, we have to review the literature and the already available information. The next step is the formulation of research objectives. And this is the most important step in this. Why in this the question may arise that why do we want to carry out research and what do we have to achieve? And the important elements of these are to formulate the objectives and hypotheses. The next step is the research methodology, and the questions may arise that what additional data do we need to meet our research objectives, how we are going to collect these informations. The important elements is to formulate the variables, uh, the type of study design, whether it is the analytical or descriptive, data collection techniques, sampling, plan for data collection, plan for data processing and analysis, ethical considerations, and the pre-test or the pilot study. The next study is the work plan. The question may arise that who will do what and when. It involves the human resources and timetable. The next is the budget. The important question that may arise are the what resources do we need to carry out the study and what resources do we have. The elements in it is the available of the material support, availability of the equipments, and the finances. The next step is for the plan for project administration and utilization of results. The question may arise in this step are how will the project be administered and how will utilization of the result ensured. It involves the administration, monitoring, identification of potential users, and the last step is the proposal summary. In this, the question may arise that how will we present our proposal to relevant authorities, communities, and the funding agencies? And the important elements in it is the briefing sessions and the lobbying. This is a two-way process, like the arrows are in both the directions, and it is a cyclic process. Now, identifying and prioritizing the topics for research. The three steps in it is the identification of topic, criteria for proposing topics for research, and the nominal group technique. Now, first step is the identification of topic. Description of the health situation required for planning interventions involved are magnitude and distribution of health needs and the services available, risk factors for certain problems, people's awareness, utilization patterns, and cost effectiveness of available and potential interventions in order to formulate adequate policies and allow for planned interventions. Number second is information required to evaluate ongoing interventions that involve the coverage of priority health needs, coverage of target groups, acceptability and quality, cost effectiveness, impact on health, and to assess the progress and the need for adjustment on a routine basis. On the number three is information required to define problem situations in interventions in any of the fields mentioned in step 2 and to analyze possible causes in order to find out the solutions. Whether a problem situation requires research depends on three conditions that are there should be perceived difference or discrepancy between what exists and the ideal or planned situation. The reason for this difference should be unclear so that it makes sense to develop research question, and there should be more than one possible answer to a question or more than one solution to the problem. Now there is a example here in which the situation is this that the district X, whose population is 1,45,000, has poor sanitary conditions. Only 5% of households have toilets, and diseases connected with poor sanitation or hepatitis, gastroenteritis, worm infestations are very common. The Ministry of Health has therefore initiated a sanitation project that aims at increasing the percentage of households with toilets by 15% each year. The project provides materials and the population should provide labor. 2 years later, less than half of the target has been achieved. Now the discrepancy in it is that at the end of 2 years, about 35% of households should have the toilets, but only 15% uh, have the toilets. Now the research questions that arises, and that is the what factors can explain this difference. Now the possible answers may be three. One is the service related factors that may be such as forgetting to adequately inform and involve the population, bottlenecks in the supply of materials, differences in training and effectiveness of scientist staff, lack of cooperation between sectors. Number two possible answer is population related factors such as situations where community members lack understanding of the relationship between disease and sanitation or have other problems, for example, due to poverty, which they consider more important. And number three possible answer is physical factors and ecosystems such as hard soil or land subjected to frequent flooding. Now the criteria for prioritizing topics for research. It should be the research topic should be the relevant and it should avoid the duplication. It should meet the urgency of the data needed, political acceptability of study, feasibility of the study, applicability of the results, and ethical acceptability. Number three is the nominal group technique. It is a group discussion technique. It is useful when one wants to obtain a consensus from a group where decision making can be useful, guided by the perceptions and opinions of the various group members. The sequence of the group discussion is usually as follows. First of all the individuals express their views and then voting is done, and then there is another round of rediscussion and another round of voting followed by the discussion. The group discussion comes to an end when the results of the last vote are not appreciably different from the last but one vote. Now the health system research in Pakistan, their issues, challenges, and way forward. The goal of health system research would be that all stakeholders such as people, institutions, and activities will generate relevant high quality information and synthesize it into knowledge and will develop tools to improve health system to address the burden of disease in specific contexts. Firstly, as always, the death of credible and authentic research has emerged as biggest issue, so has been the case with the health system research. In addition, there has been a failure to create a critical mass of researchers and a research culture. Consequently, policies and political decisions in health have seldom used evidence generated by the minimal research available in the country. Supporting and strengthening of research institutions would have been a desirable approach in order to create think tanks to support and supplement government decisions. Secondly, there has never been a consensus on research priorities, and an unknown agenda has driven the research in silos without any coordination, linkages, and networking. As a result, evidence generated has not been instrumental to reduce the disparities in health across the population. The urgent need in Pakistan context is to advocate for increased resources for health sector, realizing the need, priority, and population pressure. Moreover, enabling improved resource allocation among competing priorities within health system research is also worth looking at. In this regard, WHO health system strengthening building blocks give us a starting point for improving health system performance. And institutional change necessitates a deeper study of the social and cultural factors embedded in our health system. We know that health status depends on many determinants, and with unlimited resources, we could act on all of them. Nonetheless, with resources being limited, we have to select the determinants which have the greatest impact on health. Only through health system research, a country can identify the key determinants for the health of the country. However, the conditions of success would be to keep research out of isolation, disseminate and try to get it translated into actions. Henceforth, a research which can look into all important pillars of governance, service delivery, supplies, and technology, human resources, financing, and information system could be turning point for bringing about a sustainable and meaningful change in the fragile health system of this country. Now, the recent advances on the number first is the perceptions. The title of the recent advance is the perceptions of stakeholders about the role of health system in suicide prevention in Gizar, the region in Gilgit-Baltistan in Pakistan. The results of this study is it leads to three broad themes: the suicide as a social issue, role of health system in suicide prevention, and challenges of health system in suicide prevention. Theme 1 was subcategorized into perceived situations contributing to suicide and environmental factors. Theme 2 was subdivided into major burdens for health system and lack of mental health services in available health system. Theme 3 was subdivided into lack of collaboration across sectors, unavailability of mental health professionals, and financial issues. The study findings revealed that there are multiple challenges for health system, including lack of awareness on mental issues, short of resources, and lack of collaboration in community. Moreover, existing policies or strategies need to be modified to overcome the existing challenges for the effective prevention. The conclusion of this study is this study emphasized creating awareness about mental health issues, introduction of school health programs, parental counseling session, and strengthening health system by allocating suitable budget for mental health issues and suicide prevention strategies. The number second recent advances in health system research is health system barriers and levers in implementation of expanded program of immunization in Pakistan and evidence-informed situation analysis. The results of this study is things generated from the literature review, including financing, governance, service delivery, human resources, information systems, and supplies and vaccines. Findings suggest that certain areas in the larger health system need to be improved for a more coordinated implementation of EPI in Pakistan. Moreover, it is imperative to understand community behaviors and perceptions as well as demand side issues in order to achieve the desired results. The conclusion of this study is for better immunization coverage and ultimately a reduction in child mortality due to preventable diseases. Expanded program of immunization operations and performance must be improved. Further systematic implementation research could help to develop an even finer understanding of the system wide bottlenecks encumbering the coverage and efficiency of the program. Now, the third one is the tele-rehabilitation in the age of COVID-19, an opportunity for learning health system research. The COVID-19 pandemic has impacted all aspects of healthcare delivery. To protect healthcare workers and patients across the country from the risk of disease transmission, rules, regulations, and reimbursement policies were altered to enable widespread use of telecommunications technology in lieu of in-person clinical visits. As a result, the delivery of rehabilitation in many settings was drastically and suddenly altered, with physical therapists utilizing telehealth modalities in new ways with new populations. The shift to telerehabilitation provides a tremendous learning opportunity. This point of view provides an overview of how our learning healthcare system approach to the study of telerehabilitation can promote innovation in optimal healthcare delivery and fuel new scientific discovery. Now the time for MCQs. The number first MCQ is: the psychiatrists are discussing the risk factors for increasing incidence of drug abuse in teenagers. First, they give their individual opinions, and then voting is done to identify top 5 risk factors. And at the end, consensus are made on top 5 risk factors by rediscussion and devoting of all participants. This type of data collection and analysis is called, whether it is focus group
B.
discussion. Yes, it is a nominal group technique of data analysis and collection. The number second MCQ is: in 2020, 84 cases of polio are reported in Pakistan. A researcher wants to identify how effective are the polio immunization programs in Pakistan. To yield more accurate results, which participant he has to include in his research workers. Whether he has to involve only polio workers or polio workers and national decision makers, or polio workers, national policy makers and district managers, or all the health staff involved in polio campaigns, government and community members. Which is the correct option?
D.
Yes, and D is the correct options. As in health system research, all the stakeholders has to be involved in the research process. Who in the health system research model can assist illiterate women so that they can effectively recognize the symptoms of pneumonia and go in time to the health center within their children. Uh, Whether it is by the health policy makers, while the managers at the district provincial level, district health managers, or the managers at village level. The managers at village level uh, can assist the illiterate women, that if so that they can identify the symptoms of pneumonia and go to the hospital with their children. A researcher is conducting to assess the quality of obstetrical care and facilities available in basic health unit of Punjab. A sample of 150 women are selected from the records of BHU whose deliveries are conducted there. Data is collected by distributing a questionnaire among them. The results obtained are whether they are acceptable, not acceptable. Researcher has to involve more women, or the results can be projected to all the BHUs. The results obtained are not acceptable because it involves only the community members, that are the women that have delivered that have their deliveries in the BHUs. It has not involved the health staff of the BHU and other health staff of the district and at the provincial or the national level. So it is unacceptable. A medical student wants to do his research project on the effectiveness of preventive measures of the ongoing pandemic COVID-19. Which criteria he has to neglect while identification of his research topics? Whether it is acceptability, cost effectiveness, impact on health, or utilization pattern.
B.
Yes, B is the right options. He can neglect the cost effectiveness, uh, and that method has to be adopted that is cost effective. A researcher want to do a research project. While formulating his research topic, he came to identify many research topics. While keeping in mind the guidelines for health system research, which topic he can postpone or drop from his list to work on a single project. When it is large or widespread health problem or urgency of data needed, or the culture sensitivity must be given careful consideration or duplication. D is the right option. Right option. When the researcher came to know that the relevant research has already been done, and it cannot formulate the answers to questions, and then he has to drop his research and adopt a new research topic. Number 7 MCQ is: a researcher is doing research to determine the various factors involved in initiation of drug abuse among teenagers. While conducting his research, many research subjects refuse to give informed consent. What the researcher has to do: continue obtaining data from refusal because of huge magnitude of problem, continue obtaining data from refusal because of urgency of data needed. He do not involve refusals because of ethical unacceptability, do not involve refusal because the results may not be helpful in improving their life. Which one is the correct option?
C.
Yes, C is the correct option, because if the study subjects refuse to give the informed consent, then it is unethical and should not be involved in the study. The number 8 MCQ is: a medical student started his research project on the role of streptokinase in myocardial infarction. While doing his study, he came to know that the suggested topic has been investigated before and explored major questions has been already answered. To avoid duplication, what he has to do? Whether he has to continue doing his ongoing research project because he too has done a lot of efforts, whether he has to drop the topic and switch to another topic, or whether he has to complete his research project because the other researches are carried out in other areas, or whether he has to stop his work because it is ethically unacceptable. B is the right option, because if the relevant research has already been done and it cannot generate uh, new answers or new information, then he has to drop his topic and switch to another topic. This is the key to the MCQs, and thank you very much.
Okay, thank you very much. Please stop the recording because now we have the internal feedback about this presentation. I would request Dr.